Okay, I'm for real. This is the last one for this unit. Um, I know on uploading, I did upload PDFs for morphine, methadone, naloxone, cyclobenzaprine, and ibuprofen. Um, there's plenty of drugs for this section, so I'm not even going to go there in those. I would look over those if I were you, be familiar with them. It's just more education, teaching, reminding, but those are fairly straightforward drugs. And of course, naloxone is Narcan to reverse things. And anyway, really, all I'm going to do here, this is your nonsteroidals and antispasmodics, such as your cyclobenzaprine, epidural injections that can be given, corticosteroids that are just not going to have side effects because it's just going into this thing, opioids, antibiotics, anticoagulants. We're going to cover anticoagulants on our perfusion. And I know with Pearson, the way they do their concept, there's a comfort section that covers all these others, and we covered in pharmacology. So I'm not going to hold you to it on this. So I'm going to go right into the Parkinson's. I think I missed a slide. Anyway, we're going to go into the Parkinson's dopaminergic decrease. Dopamine no longer inhibits acetylcholine. There's no pharmacological cure. Medications that reduce the severity of the symptoms. So medications, put the Pearson pages there, Karch, it starts, or it's in around page 412. I'm going to go right to this slide here. What I want you to focus on, your amantadine, which is an antiviral. You should recognize that name. It increases dopamine release. It works as long as there still is dopamine to be released. So it can work for a period of time. And then you have your mainstay, your levodopa, which is always should be given with the combination carbidopa, levodopa, or known as Sinemet. Then that combination decreases the adverse effects of the levodopa. Also, it increases the ability more of the levodopa for the dopamine to cross the blood-brain barrier and decrease the symptoms. Again, it's not a cure. It allows a decreased level of levodopa to have to be given, also decreasing the adverse effects. Most common side effects with your levodopa are nausea, orthostatic hypotension, and the orthostatic hypotension is decreased when it's combined. Table 24.1 and page 411, I wrote a note here for your Karch. Also for adverse effects, figure 24.3 goes over adverse effects for Parkinson drugs. Contraindications for a given carbidopa, levodopa are lactation, not to be given in breastfeeding. Caution in pregnancy, contraindicated in lactation. Also contraindicated if they have some skin lesions because there is an increased risk for developing melanoma with this drug. Caution if there's cardiovascular disease such as a myocardial infarction, hypertension, history of cardiac arrhythmias. Caution, think of the anticholinergic cautions, bronchial asthma, peptic ulcer disease, urinary obstruction, psychiatric history, renal hepatic disorders, pregnancy. And then go over here on your other anticholinergic. Benztropine is the only one I want you to focus on here. It's in table 24.2. It's adverse effects, anxiety, nervousness, headache, malaise, fatigue, confusion. Drug-drug interactions, B6 and phenytoin both decrease the efficacy of the levodopa. Oh, it's adverse. I mean, that's your drug-drug interaction for your levodopa. I'm sorry. Okay. Also, when they're on either of these drugs, avoid over-the-counter vitamins. I think that's really, let me glance in the text here. You have, for your benztropine, there's a prototype summary on page 617. Also, your levodopa, there's a prototype summary on page 413. You should look over your nursing considerations for your anticholinergics in both those sections following the drugs. And that'll be it for this lecture, short and sweet.